The American Heart Association says about 5% of American children now fall into a brand new category, those considered severely obese. That's a much more serious childhood disease than simple obesity. What does this new classification mean, and what can be done about it? Here to help us explore those questions are Dr. Vincent Buffalino, a cardiologist with the American Heart Association, Dr. Rebecca Unger, who has worked in Lurie Children's Hospital's Wellness and Weight Management Clinic for 25 years, and Dr. Yang-Xin Fu, a pathologist at the University of Chicago. And welcome all to Chicago tonight. Dr. Buffalino, severe obesity is a new class of risk. What is severe obesity?
Well, the traditional definition was that overweight was considered above the 85th percentile. Obese was above the 95th percentile. And now this is a new category trying to take the highest risk group, and that's 20% above that 95th percentile. So this is a small segment of severely overweight children.
And so we're looking at the official definition here. And so just in lay terms, the difference between severe obesity and obesity?
In lay terms, it's the most overweight group, period. It's not fancier than that, but it tells us that that's probably a group that's at higher risk, more likely to go on to diabetes, more likely possibly develop heart disease in the form of early blockages in many different vessels.
Yes, we have another graphic showing the potential health consequences, and as you say, it includes the likelihood or possibility of type 2 diabetes, high blood pressure, high cholesterol, and early signs of plaque in
plaque in the arteries.
Plaque
exactly.
in the arteries, even for kids.
Even for kids, I mean, studies actually coming out of the University of Chicago showed us that when they did autopsies in people who died accidentally, there was plaque in 90% of the folks under the age of 30 in that group. So we know plaque is actually pretty prevalent, but clearly worse in the group with severe obesity.
Dr. Unger, just basic definitional terms, what's the difference between obesity and, for want of a better term, baby fat?
Well, that's a good question. Basically, we're always concerned about an imbalance between the weight and the height in a child, no matter what age. And we're learning more and more about the importance of prenatal weight gain and weight gain early on in infancy, and how that sets up children for a lifetime of being increased risk for being overweight and obese, and therefore consequences of obesity.
So, in other words, if an expectant mother gains excessive weight during pregnancy, that is a potential factor in the weight of her child.
We're learning that that's true. We have to be careful really from the very beginning to make sure that the habits are in place to have healthy eating habits, healthy physical activity from prenatal on through the rest of childhood.
Dr. Fu, my understanding is that there's a lot that's being learned about the causes of obesity or severe obesity that is new, that has to do with the bacteria that all of us have in our guts. What is the potential connection between bacteria, the kind of bacteria that we have, and obesity?
So the recent study show if you take feces from obese patient and put it into mouse, and mouse will become obese, and their children will become obese, suggesting that microbiota or gut flora or bacteria in the gut, they could actually contribute to obese.
So we've done stories about this, how there are such things as fecal transplants, and for example, as you say, taking the feces from say a mouse that's obese and putting it into a mouse that is not, that can trigger obesity in mice.
Yes.
And is there a reason to believe that the same potential exists in humans?
Yes, they're actually taking feces from the human patient and put it into actually normal mouse, and the mouse become obese.
So what does that suggest in terms of possible tools for fighting obesity?
So you can argue that potential selective antibiotics only eliminate those we call obese bacteria, and therefore maybe we can promote space for lean bacteria to grow out, and also there could be in the future some specific drug that can limit those obese bacteria or their product, like their metabolite. Therefore, you can control in this way.
So, because one of the concerns, as I understand it, is that the widespread use of antibiotics wipes out all the bacteria, the lean bacteria and the potentially obesity-causing bacteria. Is that, tell us more about that.
Yes, the broad spectrum bacteria may have a unwanted result, and you may actually somehow select the obese bacteria, especially under the high-fat diet, and therefore
high-fat diets.
High-fat diets.
Mm-hmm.
So that's what I'm saying, that you need to use a specific antibiotic to select, but that may not be the best way. Maybe in the future we have to use more specific drug to target those.
Dr. Unger, this raises a fascinating possibility in terms of the treatment of obesity. The fact that one component might be the kind of bacteria that somebody carries in their gut. Is this something that the field is following?
Well, I think the key word is one component, because I think this is definitely a multifactorial problem. So I think it's exciting to have new ways to think about it, and we're learning so much about the very complicated situation that with the body, about different metabolic activities of fat cells, and how many factors are coming to play when you're dealing with prevention of obesity and treating obesity, and what we can do for these families.
The basic elements of prevention, Dr. Buffalino, Dr. Unger referred to what happens in prenatal care. Other things that you want people, just some of the basics.
I think it's back to it is the basics. It's really diet and exercise again. I mean, when we have an intervention in whether it's children or adults, it's really about changing the dynamic so that they're moderate in their intake, careful with saturated fats, not taking excessive amounts of calories or cholesterol-containing foods, and those are things that will contribute to the development of obesity in these young people. Combined with an organized exercise program, when we looked at this in the 80s, we found that if you took the kids who were not on team sports and looked at the rest of them, over 70% were either sedentary or grossly inactive on a routine exercise score. They were playing on their computers, playing video games, etc. So we know that if we can just reestablish good exercise habits in a setting of a moderate diet, we'll actually begin to control it.
Sounds very sensible. And yet, Dr. Unger, my understanding is that the success rate long-term for a child who's obese not to have problems as he or she gets older, that's a tough one. What is your experience?
It is a tough one. We know that once children are severely obese, which is what we've been talking about, it's very, very hard for them to turn that around. On the other hand, we also know that there can be some success, or we're learning that there can be some success with the individualized, family-centered approach. And I think that's what's important, so that we can see what happens with these trends. And we
Excuse me, what does that approach include?
Well, similar to what Dr. Buffalino said, we're talking about really examining the eating and physical activity patterns and trying to set some specific goals for that individual family, and I emphasize family, and then we follow up. So we know that in the wellness and weight management clinic at our hospital, at the Lurie Children's Hospital, the children who come back for follow-up, they actually do improve their weight-to-height relationship over time. And we really have to set some specific goals for the families and make them very individualized, and both hit the physical activity patterns and the nutrition and eating patterns.
My understanding is that the obesity rate is sort of leveled off, even while the rate of severely obese children is going up. What's going on?
Well, leveled off is just a recent phenomenon. I mean, the uptick is huge. I mean, if you look at the 80s, the rate was about 10%. In the 90s, it was 18%, and now it's about 30% overweight and obese. And although it's softened, we did a survey in DuPage County this last 2 years. We measured about 29,000 kids each of the last 2 years, and although it drifted 1%, across the board, it's about 30% overweight and obese in that category. And 14.5 of those were in the obese upper 5% of the scale.
Let's look at what's happening nationally and how the city of Chicago compares. As we look at childhood obesity rates, nationally it's about, according to one source, it's about 17% nationally, but in Chicago it's 25%, whereas in New York City it's 16%, in LA County it's 20%. Dr. Unger, what's wrong with the Chicago area? Why are the rates here higher?
Well, we do know that education is related to healthy eating habits, and we know that income is also related to obesity. So we have to look at the income levels involved with the urban setting that we're in, and we also have to look at different ethnicities because there are differences in prevalence rates in the different ethnicities. Not that we know the reason why for that, but there are differences, and maybe it has to do with the composition of who's living in Chicago that's contributing to that.
And that's where we'll have to leave it. Dr. Buffalino, Dr. Unger, and Dr. Fu, thank you all for being here. Really appreciate it. And Chicago Connect continues in a moment, so please stay with us.